To give you a little outline of what to expect in the workshop, first we're going to learn some basics about mental health, kind of get our feet wet in the topic, and specifically addressing the mental health. This is going to help us distinguish fact from fiction. It's going to help us learn how stigmatizing mental health is harmful to others and the damage really that misconceptions about mental health can cause. And most importantly, learn how we can stop the stigma on mental health in our workplaces, in our homes, and in our society as a whole to make our communities and our society more inclusive, more understanding, more empathetic. Then we're going to take a look inward and learn some ways to cope with the everyday stressors that we may be facing, as well as building our emotional resilience. And that's our deep-seated ability to roll with the punches, so to speak, as we face life's inevitable adversities. I think especially right now, as we face these unprecedented changes caused by COVID-19, we all are realizing the importance not only of taking care of our mental health, but being, mentally resilient, emotionally resilient, because anything can happen. It's a crazy world, and we are all vulnerable to a lot of change and a lot of events occurring. So having that emotional resilience and those coping skills in our back pocket really go a long way to keep us healthy and mentally well as we go through life. And last but not least, we're going to explore ways to be more empathetic and supportive of those around us who may be experiencing mental health issues, who may have a chronic mental illness diagnosis, or honestly, who may just be going through a rough time, may just be a bad day, regardless of the scale, regardless of the specific impact. We just want to learn how to treat people with more empathy and more inclusion in our daily lives as it pertains to mental health. This also will include understanding how diversity specifically plays a role in not only our perspectives, but our experiences with mental health issues. And I'd also like to take an opportunity to refresh everyone on the excellent mental health resources available through your employer, so that you have a place to go and resources to follow up with should you like to utilize them. The last stigma we'll touch on is the belief that individuals with mental health issues never succeed at certain challenges or cannot improve their situation. This, of course, is false. Yes, some people with mental health issues face limitations, just like people with physical health issues. Limitations can be a direct result of the mental health condition they're experiencing or of the treatment itself, like medication side effects, for example. That being said, limitations are not necessarily permanent, and they do not prevent people with mental health issues from seeking success or improvements in their lives. We all naturally have strengths and weaknesses. People with mental health issues are no different. Some people, for example, have social anxiety, and they may want to restrict themselves from being in heightened social situations for their own mental comfort. This limitation does not mean they are unable to succeed or they can't improve. It means that they may set boundaries for themselves for their own well-being. There's nothing wrong with that. We all should practice setting boundaries to accommodate our stressors and our limitations so that we can live a healthier life. And one of my favorite tips in how to combat the stigma is to regard, view, and treat mental health issues the same as we view physical health. I think that if there's one thing you can remember regarding the stigma, it is that concept. Because anytime you are faced with a situation and you are challenged to be empathetic, you are challenged to be supportive, you're challenged to be inclusive, remembering that parallel will not only help how you treat others, but how you treat yourself. And the good news out of really all of this, and really what shapes this parallel, is that both physical and mental health issues can be improved. They can be improved and even prevented when proactive measures are taken. Just as with physical health, we are aware of our bodies. We're aware of how our bodies feel. We're aware of ongoing symptoms that we may be sick, we may just not be fully ourselves. We're aware of how we proactively take care of our physical health. We're aware of the foods we eat, the diet we choose, whether we exercise or not, or how much we exercise. We take proactive steps, and if we don't, we're at least aware that we are neglecting, for lack of a better word, to take proactive care of our physical health. The same principle applies to mental health. We can take proactive care of our mental health. We can be mindful of how our brain feels, how our emotions are doing, and we can both prevent heightened emotions or emotional dysregulation by applying self-care, applying coping skills in our daily life. And we can also eliminate the escalation of emotions, eliminate the escalation of the impact of our mental health by putting in additional coping skills, by getting help, by talking to people, so that we're able to maintain mental well-being. The first one that I'm going to highlight is number 10, which is eat/drink mindfully. Eating, drinking mindfully is a great self-care technique because you already have to do it. You're already going to be eating or drinking throughout the day. So when you're doing this, this is a way for you to get some duality out of an already experienced task. So for example, you're on your lunch break, and many of you, again, busy work day, you're still thinking about the meeting you have right when you get back from work. You're thinking about, how you have to finish off paperwork, etc. And instead, take this time for yourself. Take this time to focus on what you're eating and what you're drinking. Do not think about what you have to do when you return to work. Do not think about what you have to do at 5 p.m. Do not think about what you have to do in 3 months. Think about what is happening now. Mindfulness as a practice involves 3 main concepts. The first is to stay in the moment. So again, don't think about anything but your current experience. Naturally, you're going to have other thoughts pop into your head. Don't get mad, don't get frustrated. Mindfulness is an acquired skill, but simply try and let that thought pass. Try and dismiss that without frustration, without judgment, and continue focusing on the task at hand. Another stigmatized demographic are mothers. I myself am a mother. I'm actually 7 months pregnant with my second, so going to be a mother of 2 boys soon. And I can tell you firsthand, it's not always easy. And yet, in our society, especially in our modern day world, mothers are expected to be superwomen. They're expected to never feel overwhelmed by the duties of parenthood. That's within our natural abilities. So we can't, have bad days. We can't need that distance or need self-care. We need to be fully selfless to our children. And while, of course, it is important to take good care of your children, to be there for them, being entirely selfless is not healthy for anyone. Neglecting your own mental health as a parent can only really cause more damage to your children, as you will inevitably project those negative emotions or that heightened anxiety onto them. It's not by choice per se, but we can only handle so much as people, and as mothers, as parents, there's a lot that can overwhelm us. So it's important to take the time we need for ourselves, whether that's a break from our children, whether that's just, having the willingness to ask for help, so that we can take care of our own emotional state and ultimately not take that out or deteriorate our relationships with our children or our significant others by trying to bottle it up, which is not a healthy process at all. And last is limit. This is very important and I think very often overlooked. And I want to emphasize that you, most likely, not positive on all of you, but most of you, are not a mental health professional. Remember that while your advice and support is well-intentioned, and it is important for you to be there for others, remember to avoid giving advice that is outside of your understanding, outside of your skill set. Be honest that you aren't comfortable or you aren't able to offer advice because you don't have that experience. Don't be afraid to limit yourself in that way. It's better safe than sorry than giving advice that someone perhaps holds on to and attempts, but perhaps fails because it is not something that you have the full comprehension of. If you are interested, if you're passionate about mental health and you want to apply your knowledge, you want to share your advocacy, and you want to combat this stigma in an active way, we have a initiative called our Pledge. It's the pledge to rethink the stigma on mental health. And essentially, through this training course, you already are at an advanced level, essentially, to take that pledge and continue taking steps to destigmatize mental health and be more inclusive and supportive of others.